Hey everybody, and welcome to the Reinhardt's Rundown. Today we're reviewing an acronym to help us remember which drugs can cause or worsen heart failure and cardiotoxicities. Now there's a well-known acronym, DI Nation, that people frequently reference, but many of you know I work with a lot of underserved populations, a lot of heart failure patients, so I tend to refer to a different and more thorough acronym in my head to help me remember. Heads up, it's also a little bit racier than DI Nation, so it must be the PG-13 acronym. The acronym I use is I had Nation's trip on Coke and alcohol. This is true. This is what I say in my head. Let's go through it. Immunosuppressants. These are drugs often used for autoimmune conditions, medications like TNF-alpha inhibitors, rituximab, and etanercept. There are lots of biologic medications in this class, even interferons, which we've used historically for hepatitis and other autoimmune conditions would be here. Hydroxychloroquine or Plaquenil. This drug has been a hot topic over the pandemic the last few years, but it's used in rheumatologic conditions. It does have a rare side effect of cardiotoxicity that progresses to heart failure. Amphetamines and other stimulants. So obviously something like meth or methamphetamine abused substances. But this is a reminder also for the cardiac risk that Adderall or other amphetamine-like drugs for something like ADHD, where it might aggravate a cardiac condition. D, dipeptidyl peptidase 4 inhibitors or DPP4 inhibitors, anti-diabetic drugs like sitagliptin and alogliptin. N, non-dihydropyridine calcium channel blockers, specifically diltiazem and verapamil, can be problematic in heart failure patients with reduced ejection fraction. And also A, antiarrhythmics, particularly class 1 agents, procainamide, quinidine, flecainide, all those pill in the pockets, really not the best option with heart failure patients, and we prefer something like amiodarone or dronedarone for heart failure. T, thiazolidinediones, another diabetic class of drugs that can increase edema. Itraconazole, an antifungal. O, oncology agents. This is a big category. Obviously, doxorubicin, daunorubicin, anthracyclines in this class can be problematic, but also tyrosine kinase inhibitors like imatinib, trastuzumab, which is used in breast cancers, lots of others as well. So it's a pretty intense category with lots of cardiotoxicity. N here stands for NSAIDs, even OTC anti-inflammatories like ibuprofen, naproxen. Prescription NSAIDs are not necessarily safer in heart failure patients and can worsen heart failure symptoms and edema. S, systemic steroids. Obviously, we think here about anabolic steroids, but even patients who are really sensitive to fluid overload, corticosteroids can worsen their condition. Okay, we're at I had Nations. TRIP is next. This is short for triptans, classes of medicines that are used for migraine and headache. Triptans cause vasoconstriction, and so they would be contraindicated in patients with a history of cardiovascular events or uncontrolled hypertension. And finally, what are they tripping on? Coke and alcohol. This is exactly what they sound like. Cocaine and other illicit drugs, as well as excessive alcohol, can all contribute to heart failure development and cardiotoxicity. So the next time you're doing a medication evaluation or reviewing which factors might be worsening your patient's heart failure, say to yourself, I had Nation's trip on Coke and alcohol. That's the Reinhardt's Rundown.